I'm Mike Tank. Dana has the night off. We begin tonight with a growing crisis right here in the Wabash Valley. Rural hospitals are fighting to stay open as they deal with steep financial losses. But there is something that can be done to get rural hospitals back in the black. David Shepard has an in-depth report.
The next legislative session here at the Indiana State House could be a crucial one for rural hospitals like Greene County General. In fact, the Indiana Hospital Association says they fear what may happen if lawmakers don't act.
I think that healthcare is the most vulnerable that it's ever been. It's at a really crucial point right now.
That's Brenda Reed, CEO of Greene County General Hospital in Linton. She says her hospital is facing a crippling combination of rising costs and lower reimbursements.
Medicaid rates in Indiana have not been adjusted in almost 30 years. And so if you're taking the prices 30 years ago compared to the prices today, it does not match.
But there's more.
With growing inflation, everything costs more, and especially staff. We're heading into a very unsustainable situation if things don't start balancing out.
Brian Tabor is with the Indiana Hospital Association.
Many of the patients, the vast majority, in fact, of patients are covered by government programs. So that could be Medicare, Medicaid. For some of our rural hospitals, that means the number of patients on any given day, 75%, 80% are covered by these government programs.
The problem? Well, according to Tabor, Medicare reimburses rural hospitals for 87 cents for every dollar of cost. In Indiana, Medicaid pays even less, about 57 cents for every dollar.
That adds up. It makes it very difficult for a lot of our rural hospitals to operate when those government payments fall so far below the cost of delivering services.
To get those rates increased, state lawmakers will need to intervene. During a recent visit to Greene County General, I asked Lieutenant Governor Suzanne Crouch, who's also running for governor, if state lawmakers have done enough to address the growing crisis. Her answer:
while the General Assembly focused on hospitals this past session, hospitals alone aren't responsible for the rising healthcare costs, and so we as a state need to take a holistic look at the problem and find a solution where everybody has a little give and take that results in quality healthcare but affordability for Hoosiers.
So we still have work to do.
We still have work to do, absolutely.
Now, Tabor admits raising reimbursement rates won't solve everything, but it would be a step in the right direction. At Greene County General, Reed says if lawmakers don't act, the consequences could have a major impact on this small community.
We've seen some of it in our state of rural hospitals closing or reducing services significantly. And I think that, yeah, it's going to reach that point where we have to choose service lines and which ones can stay open and which ones can't stay open, and it's those are the hard decisions that are going to have to be made, and we've seen it happen in other communities. I pray we don't have to do that in this community. I really think that we need everything we've got, if not more.
And if Greene County General were forced to close down the road, hospital officials fear the consequences would be dire.
There are people in this community today that are alive because we are here. If this hospital were not here and we're not as close to their home as we are, I don't think they'd be here today.
Now, the Indiana Hospital Association says it's going to take state lawmakers and federal lawmakers as well to make this work and to save rural hospitals. If not, some may have to cut services or worse, close altogether. Reporting from the state capitol, I'm David Shepard.
You can hear much more from hospital officials on our website, mywabashvalley.com.